that time frame of right now overrides anything, right? I'm gonna get clean, but I'm doing it tomorrow. I swear to God, today is my last use. Tomorrow it's gonna be different, right? Because they're so in the moment. And that's one of the reasons why we really try and work people in on the same day when they're ready for help, or get them care as soon as they get it, as they can. Because if they're in that moment when they can accept help, tomorrow might be different.
At the September local Alcohol and Drug Planning Committee meeting, we heard about the Oasis Center, a new substance abuse disorder clinic in Medford that focuses on providing integrated medical services, resources, and support to families, as opposed to only individuals.
Our tagline is "We're more than a clinic, a community," and we're co-located with the Addictions Recovery Center. Thank you so much to the ARC. This is our waiting room, and our regular hours are Monday through Thursday, 8 to 5, and Fridays from 8 to 2. And this is our mission, which is to transform the lives of families in recovery through integrated social and medical services. And what that means to us is that we look at the family as our patient. We're working with the patient, the parent, through all the stages of recovery, and then we're also working with the child and the parents' parenting capacity, and just really working to heal the whole family and to support them in their success with social supports, medical care, mental health care, just through their whole journey. And we're really a medical home for families that are affected by substance use disorders. We provide pediatric care, prenatal care, primary care services. We're really a family-centered agency, so we encourage parents and caregivers to bring their children to their visits, which is, kind of unusual for a medical clinic. But as you'll see in just a moment, we have a really fantastic family room and provide some great family support services. We all work together as a team to really integrate the care and work as a care team to provide all the services for families. And this all happens within non-stigmatizing, non-judgmental, really supportive environment, and working with families through all their stages of recovery.
I just wanted to take a little time and talk about our family room and what an incredible, unique space that is that we have at Oasis. Not only do parents have the opportunity to have high quality child watch, as we call it, but it's really also a place that parents can come and interact with their children in a safe environment where they can play, and I can help them with any questions or concerns they might have about their child's behaviors, development, academics, things like that. And then we can go on to kind of dig into those topics a little more in depth.
And Sasha is also able to do home visits and help people in their environment, which is really nice, particularly with more complex parenting challenges. So we do medication-assisted treatment. We do a lot of buprenorphine. We're also able to do Sublocade for patients, which is the injectable once a month buprenorphine, which is a great option for a lot of people who really can't stay stable on their oral medications. We also do medication-assisted treatment for alcohol use disorder, Vivitrol, and other medications we use with that. We have the full range of primary care that we do here. We now have a pediatric nurse practitioner, so we can do full pediatric care as well. We have a mental health therapist who is with us, who can do either shorter sessions like integrated behavioral health, or do ongoing mental health therapy, and also couples counseling. And our multidisciplinary team is for patients who have what we call high systems involvement. So they have involvement with community justice and self-sufficiency and child welfare. That time frame of right now overrides anything, right? I'm going to get clean, but I'm doing it tomorrow. I swear to God, today is my last use. Tomorrow it's going to be different, right? Because they're so in the moment. So that's an important thing to think about when we're dealing with people, and that's one of the reasons why we really try and work people in on the same day when they're ready for help, or get them care as soon as they get it, as they can. Because if they're in that moment when they can accept help, tomorrow might be different.
Right now on our multidisciplinary team, we have about 15 families. And with those 15 families, they're all signing on as they want to sign on. They're making the obtainable goals that they want to make for themselves. We've had about 20 families, I think, graduated out of the multidisciplinary team since we opened it. And I think that right now it's really a nice resource for them since community family court shut down, because it's a lot like community family court, excluding there's not a judge and you're not going to jail if you don't do something you're supposed to.
I just want to give a little background on the Nature Oregon title. You've maybe heard about programs up in Portland called Project Nurture. Project Nurture is a really successful integrated model at 3 sites up in Portland where they have integrated substance use treatment and prenatal care and provided that kind of wraparound support. And they've provided some funding for us to do basically a branch of that program here in Southern Oregon, and they're calling that Nurture Oregon. And it's really exciting to be able to see women find their prenatal home with us.
I am peer support here at Oasis, and like Hillary said, I meet with all of the OB patients with her initially. As peer support, I kind of strive to just empower women by sharing my personal experience, not only with my addiction, but also with my personal experience with Oasis. I was a client here at Oasis, and I was 2 months pregnant with my son when I came in. And I think a lot of women just come in kind of nervous about mat therapy or, just making a big life change. And I'm living proof that this program works. And I think just being there with them is helpful.
If anybody has any follow-up questions, feel free to let us know. This is our phone number. We're also on Unitas and Reliance. Check us out.